Hello, welcome to the Robert Parangi podcast. We are here to help you on your journey to getting healthy. So let's get started.
Okay, I'm beginning an obesity medicine practice, and I think that one of the main important factors of controlling obesity is nutrition. I've had several patients who've had very good results with Tigue. She's a registered nutritionist dietitian who is able to help a lot of these patients with goals. So I'm gonna open the floor to Tigue. I just want to get an idea of what your approach is when you see a patient who's overweight and needs to lose weight.
Hi, so my name is Tigue, and I'm a registered dietitian as well as a certified diabetes educator. I've had a private practice for the past 12 years, and I specialize in weight management and diabetes management. I also do some gastrointestinal issues, and I see children and adults. Prior to this, I was chief dietitian in a couple local hospitals as well as working in a few diabetes centers. When I first see a new patient, I interview them to see what their usual diet is, ask them what they normally eat on a typical day, what their activity level is, look at their labs, their medical history, family history. And then we talk about what worked for them in the past and what didn't. And I go through their food likes and dislikes, allergies, and then we start from there. What I always recommend all my clients do is keep a food log of what they eat during the day. I find it really helpful. They can use paper or there's a few apps I like on smartphones, weigh themselves, get support from their physicians as well as their registered dietitian. I do ask them to possibly see me at least once a month because I find that follow-up is really important. And a lot of the insurance plans do cover pretty generous nutrition benefits now, so it usually is a nice feature that they do have available to them. So after we get through the initial assessment, then we talk about how to plan their meals, shopping tips, how to food prep certain things, how to pick things when you're out, when you're dining out, and a lot about portion control because I have measuring devices in my office that I show people, and I teach people how to read the food label. And there's a lot of healthy foods out there, but if you have too much olive oil, you're going to get too many calories, even though it's super healthy. The same with like nuts and seeds, which a lot of people know are healthy, but if you eat too many of them, you're going to gain weight just like you would with potato chips. So it's all about portion control.
Yeah, I think it's good that you get them to the monthly follow-ups because that's key. That's when you see the results of how they're doing or how they're not doing. And a lot of people, it's easy for them to get lost to follow-up. So I think it's good that you have a monthly follow-up for them.
Yeah, I do find the people that do come monthly, they do the best. They really do. When you look at when the year goes by, I know you and I have that one patient in common that she just did amazing. Yeah. And people need support. They have a lot of probably negative history with dieting. They need that positive support from the health professionals.
So it sounds to me like you like to customize the diets for them, which I think is very good.
Yeah, definitely. There's a lot of people that don't want to have milk or dairy because they don't like it or they're allergic, or someone else won't. A lot of people won't eat fish. I'm finding more and more. So you have to work around their food likes and dislikes. There's some people that don't cook at all. So we have to figure out how we can get things that are prepared already that are still going to be healthy. I had someone the other day who doesn't even have kitchen facilities. So that's a challenge in itself.
Do you ever work with these meal plans that they have, that they deliver the food to the person each meal?
Yeah, some of my patients have definitely tried them, and I think they are a good option for some people. It actually shows people how to cook, which is amazing. So that's always nice.
Yeah.
But we do see on a lot of them that the calories are pretty high. I've seen some with like 900 calorie meals, which isn't going to work for women for sure. But
Sure.
Yeah.
Sure.
But it is a nice option.
I'm just going to ask you some thoughts on various diets. I know you're going to have different opinions on them, and the Mediterranean diet.
So the Mediterranean diet is probably one of the top diets or meal plans that help with cardiovascular issues as well as long-term health. And it's really a very moderate diet where you eat a lot of fish, fruits and vegetables, not a lot of red meat, olive oil, limited sweets, maybe a little red wine. So it's a very doable meal plan, and it's basically up there in the top of the list.
Sure. South Beach diet?
The South Beach diet is also really a good plan. It goes in stages. So the first beginning stages have very little carb, and then they build on that and add healthy carbs. And there's a lot of nice books out that you can get in the library or purchase with additional recipes. And the main thing I find with that meal plan is that people need to advance to the stages where they do include carbs. A lot of people just freeze at the no carb, and then they give up at some point. Exactly. Yeah.
What are your thoughts on like keto diets and low carb or extra low carb diets?
Yeah, they've been around for a lot of years, and they keep changing the name of them as we go along.
Yeah.
But I think they do work for people that eat a lot of carbs and have been overdoing the carbs. When they go to low carb, they definitely lose weight. It's just that many times it's not sustainable over time. Yeah. And then keto is actually very high fat and then moderate protein and very low carb. So that also, it works in the short term, but I recently had a few patients that did that and they lost, but they regained it all back as soon as they started eating a little bit more normally.
Okay.
Yeah.
Another question for you. What do you think of some people claim that high fiber and high protein help them feel full quicker? I know that no one macronutrient is superior to the other as far as diet goes, but that's just something I've heard from people. I wanted to get your opinion on.
Oh, yeah, definitely. Especially the higher protein, but I always encourage like leaner protein, like instead of having a big fatty steak, have like chicken. But I do find people feel more satiety after a protein meal, and they're less likely to grab snacks later. Yeah, so that it does work. And fiber also is important, like if you're having carbs, have whole grain carbs, like whole grain or multigrain bread or a brown rice, whole wheat pasta, things like that. Definitely.
Great. I think that you're a wealth of information. I really do encourage my patients to see a nutritionist. I have your cards on my table. I always tell them, look, I really want you to meet with somebody so you can figure out what you're going to do for your diet. I don't want to just give you the pill and send you on your own. They'll start coming your way. Now, of course, COVID has slowed everything down, but we're trying to get back on our feet here.
Yeah, it has. And I've been doing a lot of telehealth, which some people find really convenient, especially if they work long hours, and we can do them, at all times of the day. So that also works. And I think the nice thing with registered dietitians can really support physicians in this way, because our visits are like an hour. So we have a lot of time to really teach people and delve into their needs and really be like a support person for the physician practice also.
The number one most important person that I say is the nutritionist. And number two is your exercise physiologist.
Oh, yeah, definitely.
And that's it. Those are the two people that I want you involved with.
Exactly. And I think being patient is really important, too, because people like to think of a quick fix. If they don't lose weight quick enough, they feel like giving up. But if they even lose 2 pounds a month at the end of the year, you're 24 pounds.
I totally agree with you. I hope that we'll be able to continue to work together, and I hope that the volume will pick up now that getting beyond COVID and learning to live with it. And I know a lot of people put on weight in this period.
Yeah, there was a lot of bread making during this period. People really got into making bread.
Yeah, so I think it's time to help them try to get some of that weight off.
It's definitely time to regroup.
I offer medications, but I also, more importantly, offer the counseling that someone like yourself gives, and the exercise that the personal trainer can help with. And I don't want to go into details on that right now, but right now I think that we've gotten a reasonable amount of detail on the nutrition and the importance of nutrition in the whole weight loss process.
Yeah, I think the combined approach is really important. To look at all the tools that you might have available to you to make this happen.
Yep.
Sounds good.
Okay. And in the short run, there's not much you can do. Weight loss is going to take time.
Mm-hmm.
You know, people who are overweight and they're worried about COVID, you know, I mean, there's only limits to how much we can allay their fears until their weight is gone. And
True.
that's going to take time. No quick weight loss lasts. So,
Exactly.
Except for surgery, except for bariatric surgery, but we're not going there. We're trying to work with people who we can work with. Of course, I do offer bariatric surgery for people who are beyond the weight, but I don't want to get into that too much tonight because I just didn't think it was more appropriate to the conversation.
Mm-hmm. Yeah, and I think if people just they start eating healthier, instead of being afraid of the carbs, eat some healthy fruit every day, have the vegetables, these foods with just super nutrients in them. And if anything, it just helps when they have a much more quality meal plan and diet.
Sure.
I try to have people do, like for men, let's say, I would have them try to keep the carbs in each meal 45 grams or less. If they had like a cup of brown rice or black beans, like more of the carbs that have fiber and protein in them, sometimes it helps with the protein content with it. Have a piece of chicken with that. It helps. Sometimes when people go into the carbs, we're talking about 3-4 cups of rice or a Big Hero sandwich. So eating some healthy carbs at each meal is still important to incorporate even in that situation, rather than avoiding them totally. In fact, recently I had a guy who was eating like the Italian Hero for lunch every day, and I told him to have a turkey sandwich on rye bread, and he was so thrilled that he could still eat a sandwich on bread, and it hit the spot when he didn't need to add anything extra to that. He just got back to work after he ate it. He was pretty happy with knowing that he could actually have rye bread on the meal plan. And what happens is when you order a sandwich like on a hard roll or a ciabatta, or you're talking about that bread is equal to having maybe 4 to 6 to 8 slices of bread, where when you get a sandwich on rye bread, it's barely 2 slices. It's usually sliced pretty thin. So the carb value of a rye bread sandwich is only 30 grams, where a Hero could be up to 100.
Mm-hmm.
So it's the amount and the type of carb both make a difference. Yeah. Challenging for all of us, that's for sure.
Yeah, no, listen, it's great to have people who are experts on this topic, because it's such an important topic for lots of medical conditions. I mean, obesity is the one we're talking about tonight.
Mm-hmm.
Of course, diabetes and all kinds of other afflictions as well. But obesity is the main focus for tonight. And, I think you've done a very good job enlightening people on some of the important things they're going to have to deal with. But I think it's a coaching process, because they really do need to do that monthly follow-up, because it's easy to get lost. Easy to get lost in your food town.
No, definitely. And I even have a lot of people that I ask them to, in about 10 days after I see them, send me off your food logs. There's a way to do that through a lot of the apps, and they send me their file, and I look at it and I give them some tips midpoint. And that way somebody's accountable to them if they know they're sending something to somebody. Yeah, I really like the ones on the smartphone apps, because you get such detailed carbs and protein and fat and other nutrients. So things you can't figure out in your head all the time.
Sure.
I really like MyFitnessPal as my number one favorite. And then there's another one called Chronometer, which goes into more smaller nutrients. If you needed more phosphorus or potassium or something like that, would give you more of those details. But MyFitnessPal is one of my favorite ones, definitely. I use it myself many times, and I find people do really well using it. But some people, it's a job to use it too, So, but using it helps.
Sure. Great.
Well, this has been a pleasure talking to you.
Yeah, I agree, and I'm looking forward to be working with you on the outside more.
Great. Sounds like a good plan.
Thank you for tuning into my show. If you'd like to call for a consultation, my office number is 201-265-7564. Thank you.